So basically, glucagon is the hormone that balances out the insulin. So when the body's under stress, if you're exercising, if you're sick, your body needs more glucose for energy or to heal the disease. So, a normal person have that glucagon to produce glucose at the level of the liver to prevent hypoglycemia. Well, in type 1 diabetics, as well as type 2 diabetics that are on insulin or hypoglycemic medications, they're obviously at high risk of having hypoglycemic events because of these medications. So they have to be carrying glucagon with them. Glucagon is the lifesaver. Basically, if they have an episode of hypoglycemia, that they can respond to it, meaning with that they can go and grab something to eat, something to drink immediately, and they'll pass out. They need this hormone to be able to bring the glucose levels up and not having to, call 911, having to be rushed to the hospital. And as a matter of fact, I want to show you to you, this is what the glucagon pen looks like. It sounds easy, but it's not. So the persons around you have to be able to know how to inject these, because otherwise it will be useless. So luckily enough, we have now a nasal glucagon, which you just push and the glucose goes up because of the inhalation of the glucagon into your system much faster, a much easier way for other people to be able to help you. But it's very important. And, unfortunately, physicians, we sometimes lack adding that prescription to our patients. But any diabetic that is on insulin or any medications that can cause hypoglycemia should have one of these with them all the time, in my opinion.